We are Iowa.
All right, this is Tinnitus Awareness Week. It's a week that's focused on educating people about the condition that you may be experiencing in your ear, but maybe you don't know anything about it. So that's why we've got Audiologist Dr. Mike Sharp, who is here this morning to talk about the condition and also those efforts to really help people who may be suffering from this. And Mike, you know, there are a lot of people out there who probably don't know what this is, but like I said, they may have it. So what exactly is tinnitus?
So it's a condition where you hear a sound that's not present in the room around you. So for example, a lot of us have probably gone to a concert, something like that, and after we've left, you think, oh, my ears are ringing a little bit. And that's the most common question you'll get when you're at your doctor's office. Do your ears ring? Well, there's actually a lot of different sounds it can be. Some people it'll be ringing, some people it'll be bells, some people it'll be, in rarer cases, even music that they'll hear. Now, when you hear the loud sound, it'll go away eventually. But when you hear that sound, your hearing has gotten a little worse, but it never gets all the way better. And so those little things will build up over time, and then eventually the sound doesn't go away.
So if you have the ringing for a long period of time, like how long, if you have that ringing, should you become concerned?
So most of the time, if it's around a loud sound, it's like 24 to 48 hours, then it'll go back. A lot of times people who are exposed to loud noises because of jobs, hobbies that are louder, those sorts of things, they just have it, it's there, and it can worsen over time. A lot of times it goes along with having a change in your hearing, specifically related to noise exposure. It can be other things as well, but it can get worse over time, and then it can start to become bothersome. And a lot of times it's because people don't fully understand where it's coming from, why it is, what it is. So usually the first step is to talk to your doctor and a lot of times get a hearing test.
Okay, and so for people who get it, and you touched on a little bit of it right there, but how exactly do they get this? Like, is this something that maybe we're preconditioned to have, or can anyone get it?
Mm-hmm. Most of the time it's environmental. It's as a result of having some exposure to loud sounds or some change in hearing. And so that's why getting a hearing test is so important, because that's the first step in figuring out exactly what's going on with it, where it's coming from, and kind of what you can do about it.
Okay, so on that note, let's say if I find out that this is a condition I have, where do I go from there? How do I manage this?
So most of the time it's talking to a hearing care provider who is versed in tinnitus. And what'll happen is you'll get a hearing test. If there has been a change in hearing, then even though there's no cure for tinnitus, there's lots of ways to manage and mitigate the potential for it.
And I did have to ask Mike, by the way, how to pronounce this, and he said that you can't say tinnitus, you can also say tinnitus.
Absolutely.
So we're just having a disagreement, but we're completely right either way. Totally okay. I'm sure someone's going to send an email saying one of you is wrong. Okay. So,
just say me. That's okay.
So in terms of the awareness week, what exactly does that look like?
So a lot of it is just getting people aware of, if you have it, there are things you can potentially do about it. No, there's not a cure necessarily, but there are things you can do to help make it not as big of a factor in your life. And a lot of times if there's a hearing loss, treating the hearing loss by things like hearing aids can help people to feel a reduction in it, not necessarily gone. Other things like when you're in a quiet environment, you'll notice it more because you've got less auditory stimulation. So listening to music, having white noise machines, things to just prevent you from being in total silence are ways that giving you something else to concentrate on helps a lot.
That's good information. Where can people find out more about tinnitus or tinnitus?
So you can contact our offices at ASI Beltone. Most of the time, if you talk to a hearing care provider, they have a really good handle on hearing, tinnitus, those types of things together. So like I said, we're happy to help, and there's lots of folks in town that are good experts on that.
All right. Like we said, a lot of people could be impacted by this. So Dr. Mike Sharp, appreciate your time, sir. All right, let's go over to Peter.